Serving all of San Diego, this is your Fox 5 News.
Okay, so this morning we're showing you how to get rid of those unsightly varicose veins so you can show off your sexy legs for the summer. And here to show us how is Dr. Margaret O'Byrne to talk about this procedure that we can get if we want to. Good morning to you. Thank you for being here.
Thank you for having me. I'm happy to be here.
Absolutely. We're going to start with a little fact versus fiction. Apparently, my producer loves to pop quiz me with these fun little things. So we're going to go over some true-false scenarios and break down the myths of varicose veins. Shall we start?
Love to.
Let's do it. Okay, so the first one is varicose veins are a cosmetic problem that do not cause serious medical issues.
Well, this is actually false.
Which is what I was going to say. Let's play the game like that. I like that better.
And I'm very glad that that was our first question, because varicose veins can actually be a very serious medical problem.
Yeah.
It affects 20% of the population, both men and women, and can cause serious disability, especially in the middle to the elderly years.
Okay, very good. So you need to get it treated. Let's get our next question up, which says standing on hard surfaces and crossing your legs will cause varicose veins, as we both sit with our legs crossed right now. And that one is
false?
False, exactly.
That is absolutely false. Oftentimes, many people will describe the fact that they have their varicose veins because they've been standing and they've noticed the veins are hurting them, especially when they're standing in the kitchen. Most of us actually do have hard flooring in our kitchen, and so we've made that association that it's really because of the hard flooring, and that's why we have the veins, and that's why the veins hurt. The fact is, it's the standing. It's not the floor surface that's actually giving you those symptoms of the varicose veins.
Good to know. Is it genetic at all? Is it passed down?
It's very strongly genetic.
Okay.
So many times patients will actually try and blame themselves. Oh, it's because I was standing, I worked in retail, I was a waitress, and honestly, they really should not berate themselves at all for that.
Right.
The issue is really who their parents were primarily.
Okay, cool. Next question, true, false. Treating varicose veins will cause more veins to come out.
This again is false.
I'm winning.
Common misconception. Many times patients are very concerned that they really should not get their varicose vein treated, because then sure enough, the next day, the next month, even the next year, a new large varicose vein will erupt, and that is absolutely not true.
Okay. Pregnancy causes varicose veins to come out. Is that true or false? I'm actually going to say true on that one.
Well, you're partially correct.
Okay.
So what
It's better than mostly wrong, right?
Yeah, that's true. So oftentimes we kind of think it's a cause and effect. In other words, because I'm pregnant, I have these veins. But actually what's really occurring is the veins have been promoted by the pregnancy, but the underlying genetic predisposition for the varicose veins is there. So, for example, I use lots of examples with my patients. In other words, you know, I have quite a few women in my practice that have never ever had a child. They have never been pregnant. They have very severe varicose veins.
Okay.
I have seen plenty of cases where someone has had 8 children and has the most minor of problems. So there's definitely not a correlation there, at least the way most people think about it.
Very good. Let's get to our last true-false question, which says over-the-counter supplements and creams can make varicose veins go away. Since you're going to show us a machine that aims to do that, I'm going to say that you're going to say that that's false.
Yes,
okay.
that is false. And this is a wonderful thing to talk about as well in terms of education. There are quite a few herbal supplements that are on the market. There's quite a few creams that are promoted on the market that will get rid of varicose veins.
Okay.
And it is true that there is a whole group of supplements called bioflavonoids that actually do help with the swelling and then help with the symptoms of varicose veins. But once a varicose vein has been established in your body, there really needs to be a direct treatment for that vein to, quote, get rid of it. So, you know, I think that, again, that's a misconception to think you can take a pill or you can rub a cream and the vein's going to go away. That's not going to happen.
Okay, we actually have an animation to look at, a video right now.
Wonderful.
We're going to look at. What are we seeing right here? What is this?
So this is an example, an animated example of how a varicose vein actually forms. And what we term as venous insufficiency is when the vein walls actually stretch and the valves, which are actually inside the vein, begin to dysfunction. So you can see that these valves actually are supposed to push the blood one way, and when we have faulty valves or the vein wall has stretched, we end up having blood pooling or falling back the other way. This is an animation again of the procedure that we're going to review today called endovenous laser, using a CoolTouch laser, where the vein is actually destroyed with the laser, destroying the vein wall as well as those faulty valves and eliminating that pooling of blood.
Very good. Now you're going to actually show us how this machine works right now. You can do a little demo for us?
Yes, we are. We're very excited to do that. And what this is a CoolTouch laser. We like to use these laser technologies, and they are just so incredibly useful, especially in this situation for eliminating varicose vein disease. And what we're going to be watching today is the laser being threaded through a simulated vein, and we're actually going to be watching that live. And this is what happens inside the body as the laser is withdrawn through
look at that
the
right
vein.
There. And so, what's happening right now?
What's happening right now, if this was in somebody's body, is the laser is actually destroying this segment of vein, collapsing it as it goes. And this is actually what we did with our patient here, Tori, just a few days ago, treating her vein disease.
So if I want this procedure, I go in and I tell my doctor that I want the CoolTouch procedure. Is that what I tell them?
Right. The CoolTouch procedure, which is a type of endovenous laser that is on the market that I have used for quite a few years, and I've been just so happy with the results and so happy with the laser itself.
Gosh, it's so cool to look at, isn't it? Let's real quickly show the before picture of your patient Tori, and this is her leg before. You can really see, especially the lower part of the leg there, the varicose veins. And now we're going to look at Tori. This is after how many procedures?
She had one procedure done, and she had it done 5 days ago, not very long ago at all.
Okay.
She walked into the procedure. The procedure was done under local anesthesia. It took about 30 minutes. We were just talking earlier how quick it was.
And Tori, I want to ask you, how was that for you? Did it hurt? Was it painful?
No,
Tell me about it.
It was very simple, and it was very minimal pain. It was nothing more than a prick, and it was great.
Have you tried other things before, other creams or ointments or procedures or things?
No, not at all. I acquired my varicose vein during my pregnancies. I have 3 children.
Okay,
and, They just didn't, I thought they might go away after I had the babies and stuff, and they didn't. So I then came to see Dr. O'Byrne and did the laser.
Well, your legs look great. They look fantastic. Thank you for showing them to us. Real quickly, I want to ask you, price-wise, what are we looking at here, and how many procedures usually?
Endovenous laser is done with one procedure.
Okay.
It's very, very unusual that you would need 2 endovenous lasers, and the price can range anywhere from $1,500 to $3,000 here in San Diego.
Does insurance ever cover that, or not usually?
It can cover that.
Okay.
There are certain qualifications that patients do have to meet, like in many medical issues, but oftentimes it can be reimbursed and it can be directly covered by insurance.
Okay, so
it's a great option.
Ladies, thank you so much for being here. We really appreciate it. And if you'd like to contact Dr. Margaret O'Byrne, you can visit our website, fox5sandiego.com. Just go there right now, click on that little scene on tab. Okay, Raul, back over to you.